Part 1 of breaking down the components of the psychiatric evaluation, and you are currently here right at the beginning. So before I do any psych eval, I make sure to review any collateral information that I may have, so any referral sources or inpatient discharge summaries. I make sure that I have all the guardianship information that I needed, especially with like custody arrangements with our pediatric patients. Do both parents need to be present? Important to know if your patient's on court-ordered treatment or if they need an interpreter, and make sure to check the prescription monitoring program for any controlled meds, and make sure you know the date of their last fill for those medications. Getting into the actual evaluation, I make sure to introduce myself and my role, and then I verify their information, of course, and I verify their guardian information and make sure that the guardian is actually present for the appointment. I've had to reschedule patients before because the guardian wasn't present and they were unavailable. I explain what a psychiatric evaluation is, the process and the purpose of it, to kind of give them an idea of why they're even here today and kind of give them a heads up of the type of questions I'm going to be asking. It's also important to let them know your limitations to confidentiality, right? So we do have to report anything that involves danger to themselves or danger to others. And then I also inform the patient that they can decline to talk about sensitive topics. And I ask them if they have any questions before we get started. Whatever EMR system you're using should have the patient's identifying information already pretty much auto-populated. So this is their demographics, full legal name, their preferred name, and I always try to call them by whatever they prefer because it never hurts to just call somebody what they want to be called. Date of birth, sex, gender, race, ethnicity, any guardian information, court-ordered versus voluntary, referral sources, reason for referral, and then your date, time, and the setting that you're currently in while you're doing the evaluation. So if it's inpatient, outpatient. The chief complaint is the reason why your patient is here today in their own words. So in documentation, this is going to be in quotations because you're using what they tell you they're here for. I added some examples, so maybe they just say, I'm here because I've been having panic attacks, I'm here because I feel overwhelmed, and sometimes they'll tell you, I don't even want to be here, I'm required to be here, right? So you put that too in the quotations. And I will see you guys in part 2.